All right, let's go on to the third easiest claim to prove and win because it's a subjective claim, and that's mental health. All mental health disabilities fall under mental health. They're all rated the same, whether it's combat PTSD, anxiety, depression, somatic symptom disorder. There's about 150 of them. They're all rated the same because the symptoms are all very similar. So this is a good one to file secondary to tinnitus. If you think about it, the tinnitus, if you don't tune it out well, or actually the way the VA kind of looks at it is you've been tuning it out, it's a problem. You have all this noise, it's caused divorces, it's caused problems at work because you got to have Van Halen crank it all the time. That's a problem. And then that causes depression. So that's kind of how like a secondary for tinnitus would work if you're doing depression secondary to tinnitus. So with mental health claims, they're all rated the same, and you have ratings based on the severity of your symptoms. So you're going to need a current diagnosis of whatever mental health condition you have. You're going to need your doctor to write the current symptoms so you get that higher rating. They go 0, 10, 30, 50, 70, and 100. So mental health goes all the way up to 100. And then you're going to need the nexus. We're talking about doing a secondary claim. So if you have depression over here and your tinnitus is causing it over here, the doctor needs to make the link. It's a medical link. It's the medical nexus. He needs to say, in his opinion, on at least as likely as not basis, yes, Combat Craig's depression is caused or aggravated by his service-connected tinnitus. So all three pieces, current diagnosis, symptoms, and a nexus. You need to have all three of those. And then I would just have your doctor fill out a DBQ. If your doctor won't do this for you or your VA doctor won't do it, hit up my med team. There's an email address in the description. They can help you out, guaranteed. So with mental health claims, looking through the symptoms, do you have these symptoms? That's the first place that I would start, and kind of where I started 4 years ago or whenever I filed my last claim and finally won. All right, 0%. Nope, that's not me. 10. Nope. 30. Nope. I actually started off with a 50% rating for mental health, and then that went up to 70. And that is deficiencies in most areas of your work and social life. And mental health claims come down to social and occupational impairment. And it's weird language, but it's social life, your entire social life. What kind of problems do you have there? And then your work life. What problems do you have there? So social life would be, do your kids not like you? Do they not talk to you? Have you been divorced? Where do you have problems? And just do you not get along with your mom or your grandma or whoever it is in your family? And then are you socially awkward? Do you not like going out and you're uncomfortable around people? You know, basically everything other than the hours that you're at work. What's going on there? So read the rating criteria and see if any of these things fit you. Cameras are a good one. I have cameras and I have monitors off screen. I can see around my house all the time. I'm well armed and ready to, do whatever I need to do here. That makes me feel safe. And I've been like that since I got out of the military. I just have to know what's going on, and they're coming to get me, and I'm going to be taking some of them out when that happens. Who are they? I have no idea, but they're going to have a bad day. And I'll be ready for them. So when you compare that kind of mindset to like a normal person, normal people don't act like that. Normal people are not sitting here with their cameras and ready to defend themselves. It's just not something they do. And I guess that makes sense too, right? Because we actually were in the military. They weren't. They could have had a problem at 7-Eleven, but generally speaking, they were probably good, had some kind of plan, or working at JCPenney or whatever. That didn't happen to us. Things happen to us, and this is one of the results. So look at the rating criteria. This example with the cameras might be you, it might not be you. There's a lot of examples in the rating criteria. See if you meet the requirements for a 30% VA mental health rating, or a 50% rating, or a 70% rating. And if you already have a mental health rating and you think it's low, same thing. Go look in there and read the different verbiage under the readings. The higher up it goes, it's the more impaired you are. And then 100% is total social and occupational impairment. So it's like 0, like it doesn't really bother me. 10's like, yeah, the meds work, kind of. And then, yeah, nothing works. I can't function at any level. So these are 3 claims that are easy to prove. Tinnitus will get you points on the board if you're not service connected for anything. And then migraines and mental health are 2 high value secondary claims, because high value claims are 30% ratings or higher, typically, if you prove it and you get your symptoms documented right. Migraines are 50%. Mental health is typically 70%. That's high value claims. And if you are at 0, trying to figure out where to start with tinnitus, win tinnitus. You have to win it first before you file secondaries, right? Got to have something first before there's a second. So, and this, I know this is confusing, but just wait for your claim to be adjudicated and win the tinnitus claim, and then launch the migraines and the depression. That's the strategy that I recommend, and that's a strategy that you should do. Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form, boom, you're done.